So, what is a hysterectomy? Let's dive into the details. Well, a hysterectomy is a surgical procedure to remove a woman's uterus. This operation can be life-changing and is often performed for various medical reasons. The uterus is where a baby grows during pregnancy. It plays a crucial role in a woman's reproductive system. After a hysterectomy, a woman will no longer have menstrual periods and will not be able to get pregnant. Hysterectomies are quite common and are performed for conditions like fibroids, endometriosis, or cancer. They are major surgery, but they are generally safe. Recovery times can vary, but most women can return to normal activities within 6 to 8 weeks. There are different types of hysterectomies. These include total hysterectomy, partial hysterectomy, and radical hysterectomy. The type of hysterectomy will depend on the reason for the surgery and other health factors. Your doctor will help determine the best approach for your specific situation. It's important to remember that a hysterectomy is a big decision. It can have emotional and physical impacts, so it's crucial to weigh all the pros and cons. It's really important to talk to your doctor about all of your options and what to expect. Make sure to ask questions and understand the potential outcomes and recovery process. Hysterectomies are performed for a variety of reasons, each tailored to address specific medical conditions and improve the patient's quality of life. Some common reasons include fibroids, which are non-cancerous growths in the uterus. These fibroids can vary in size and number, sometimes leading to significant discomfort. They can cause heavy bleeding, pain, and other problems such as pressure on the bladder or bowel, making daily activities challenging. Then there's endometriosis, a condition where the tissue that lines the uterus grows outside of the uterus. This misplaced tissue can lead to severe pain, especially during menstrual periods. It can cause pain, bleeding, and infertility, significantly impacting a woman's reproductive health and overall well-being. Uterine prolapse is another reason. This is when the uterus drops down into the vagina. This condition can lead to discomfort and urinary issues. It can be caused by childbirth or aging, weakening the pelvic floor muscles and ligaments that support the uterus. And of course, cancer of the uterus, cervix, or ovaries may require a hysterectomy. This is often a necessary step to prevent the spread of cancer and to improve the chances of recovery. It's important to note that a hysterectomy is not always the first line of treatment for these conditions. Doctors often explore less invasive options first. Often, other treatments can be tried first, such as medication, lifestyle changes, or less invasive surgical procedures, depending on the severity and nature of the condition. There are 3 main types of hysterectomies. First, there's the partial hysterectomy, which involves removing only the uterus, leaving the cervix intact. Then there's the total hysterectomy, which involves removing both the uterus and the cervix. Finally, we have the radical hysterectomy, the most extensive type, which involves removing the uterus, cervix, surrounding tissues, and the top portion of the vagina. This is typically done in cases of cancer. Your doctor will recommend the type of hysterectomy that is best for your individual situation. Surgical approaches for hysterectomies can vary significantly, depending on the patient's specific medical condition and the surgeon's expertise. Let's take a closer look at the different methods available for performing a hysterectomy. First, there's the vaginal hysterectomy, where the uterus is removed through the vagina. This method is often preferred because it doesn't require any external incisions. This method typically offers a shorter recovery time and fewer complications, making it a popular choice for many patients. Next, we have the abdominal hysterectomy, which is another common approach. In this approach, the uterus is removed through a larger incision made in the abdomen. This method allows the surgeon to have a better view and access to the pelvic organs. This may be necessary for larger uteruses or more complex cases where other methods might not be feasible. Lastly, there's the laparoscopic hysterectomy, which is a minimally invasive approach. This method uses small incisions and a camera to guide the surgery, allowing for precise movements and minimal disruption to surrounding tissues. It often results in less pain, minimal scarring, and a faster recovery time compared to traditional methods. The best surgical approach will depend on several factors, including the size and position of the uterus, the underlying reason for the hysterectomy, and the surgeon's experience and preference. It's important for patients to discuss all available options with their healthcare provider to make an informed decision. Recovery and aftercare following a hysterectomy can vary depending on the type of surgery and individual factors. Generally, you can expect to spend a few days in the hospital and several weeks recovering at home. Your doctor will provide specific instructions on caring for your incisions, managing pain, and gradually resuming activities. It's crucial to follow your doctor's advice and attend all follow-up appointments to ensure a smooth recovery. Deciding whether or not to have a hysterectomy is a personal decision. It's important to have open and honest conversations with your doctor. They can help you understand your condition, the risks and benefits of different treatment options, and what to expect during and after surgery. Don't hesitate to ask questions and express your concerns. Your doctor is there to support you in making the best decision for your health and well-being. Remember, you are your own best advocate.